This is J. Randall Wilkerson, author of the Heart Failure Recovery Plan, Successful Heart Regeneration Using Metabolic Enzymes. This is part 50 of a 58-part video series of the entire book, chapter by chapter. Please review our introductory video in our channel for background information. Part 50 will go into the subject under chapter 10, medical areas of concern with heart failure. And this specific subclassification is heart failure classifications. It's been mentioned throughout the book that there are various classifications like class 1, 2, 3, and 4. But what does that exactly mean? According to the American Heart Association, there are two systems. One is from the New York Heart Association Functional Classification. And what that basically means is how well you can personally perform. Class 1 is a patient with heart failure but no limitations on physical activity. And physical activity does not cause any fatigue or unstable heartbeats in the form of palpitations or pain. So essentially, most people with class 1 do not know they have heart failure unless a doctor has discovered it in some routine examination. Class 2 is a person with heart failure with slight limitations on physical activity. They're comfortable at rest and sitting, watching TV, but ordinary physical activity, sports, outdoors, bicycling can result in fatigue and some heart palpitations and possibly pain. But it's starting to get serious at this point. Class 3 patients with heart failure have significant limitations of physical activity. They can still be comfortable at rest, sitting down, eating, watching TV, but any ordinary activity around the house, not sports, can cause fatigue, heart palpitations, and pain. So if you find that any ordinary activity like going to the airport, flying, traveling to work, if you are fatigued, weak, and your heart is skipping a beat every so often, it is high time to visit your doctor and explain that to them so they can check to see what your output is. An echocardiogram can look at the actual blood flow coming from the heart and determine by the ejection fraction what your output is. Class 4 heart failure is the most advanced. Patients with that level are not able to carry on any physical activity without discomfort. Just walking to the mailbox and back, it can be too much. Symptoms of heart failure can include pain, but not necessarily, even when resting. Any physical activity is very difficult to do. Class 4 is typically fatal at the rate of 4 out of 5 in the first 12 months, and the rest, of course, do not survive much longer than that. It's time where you have to take immediate action and apply the treatment plan in this book. You cannot wait a week, you cannot wait a month to get a second opinion or to try something else. Because at class 4, the blood flow from the heart is not enough for the heart to regenerate and repair itself and keep your body and your life going. So what happens is the heart is continually being starved and growing weaker and weaker, steadily weaker, every day. Now, the two classifications can be combined to determine the current condition of a heart failure patient. The objective assessment level is listed as class A, B, C, and D. So, for example, class D means that there is objective evidence of severe heart failure in that there are severe limitations on activity and a person experiences symptoms when even resting. And what that means is you could have class 3D, which means you're starting to get some limitations, but the evidence shows that you're experiencing even severe limitations while resting. You could have class 4B, in which the objective assessment is that you're mild heart failure, mild symptoms, and yet when you try to do any physical activity, you cannot go very far at all. You cannot do ordinary things around the house without any sort of weakness. So, for example, when I was discharged from the hospital, I could not walk 80 feet. and I could not do any activity. I was extreme weakness. I essentially was in a state of what you would call class 4D, the most completely advanced level. Now, the current heart failure population statistics in the United States show there is approximately 4.8 million and rising. It is broken down among the classes. There are only 5% of those are in class 4 because most of those are dying and will die very shortly thereafter. The lifetime risk to develop heart failure for people over 40 is 20%, or 1 in 5. And that represents 650,000 to 680,000 new cases each year. Now, roughly at this current state, 380,000 or more than 1,000 each day or more than 8,000 each week will experience sudden death, and that's the statistics based upon the rate several years ago, because from the point you're diagnosed at class 1 or 2, the survival period is approximately 5 years to the point of sudden death. Therefore, these numbers are climbing quite dramatically. All of the dietary and lifestyle choices that we've covered in prior videos are causing a dramatic increase in heart failure statistics. So we're looking at a snapshot that's actually several years old. The situation is getting much worse. The foods and the nutritional problems that cause heart failure, as well as medications causing heart failure, are growing and growing quite quickly. I realize that this information in this chapter may be distressing. However, it is also motivational. It tells you that this is not going to go away. Doctors may say, well, just take these 2 pills and you'll be okay. Well, what they mean is, even though you have heart failure, just take these 2 pills and it will lengthen your life, but not by long shot, not for very long at all, because all pharmaceutical medications that are issued to heart failure patients today have no cure. There is no cure available to restore your class level. Your objective is to go from class 4, improve to class 3, improve to class 2, and on to class 1. And then ultimately, and this can take 2 or 3 years, ultimately no class. Completely restore the ejection fraction and your heart muscle strength and size back to normal. That is what I did. And it is not necessarily an absolutely easy thing to do, but it's so enjoyable to grow stronger every day. And you put the weakness behind you, and you just only have it as a memory. I bicycle every day for all errands at all. I've mentioned this before, but it's very enjoyable to go out early in the morning to see all of the wildlife, the birds, the butterflies, to take a different route each day if I want to see something, and that becomes an aspect of life that you can come to enjoy, to visit your families, to see your grandchildren, to even attend your grandchildren's wedding, and then the great-grandchildren they have. All those things are goals that you need to look forward to. This concludes this section. I'm J. Randall Wilkerson, author of the Heart Failure Recovery Plan, Successful Heart Regeneration Using Metabolic Enzymes. This book is available on Amazon in print and Kindle editions, at the Apple iBook Store and iTunes Store in an iBooks edition, and also on eBay in a print edition. You can obtain this book from the publisher, Wilkerson & Hughes, P.O. Box 777, Altoona, Florida, 32702. Just enclose a check for $24 to include shipping with the book. Thank you for listening.